It's not every time that you have a hole in your tooth and you have toothache that you should remove it. Man, you can do something else called a root canal. When you go and see the dentist will assess. Teeth is in layers. There's the outer one that you can see is enamel. Underneath that layer, it's like when you're eating hamburger. There's bread on top, there's flesh and all those things in the middle, and there's bread under. Imagine the tooth, something like that. So there's enamel, then inside the tooth, you see all those like meat and all those things that is in the hamburger. There's something inside the tooth that are called pulp. That's where the nerves and the blood vessels are. When the infection from the hole, the decay that you have, enters into that place, that's when you have a toothache. So when you come to the dentist, we don't have to remove that tooth because nothing is as good as what God has put there. If the tooth is good enough for a root canal, we can do it. What the dentist will simply do is enter inside that hole, bogolo, inside the pulp, and they will just begin to clean it out. You know, it's like when you are drawing water out of a well. We'll be drawing out all the dirt inside that place. Just imagine the way a well goes down. That's the way that pulp is. It goes into the tooth. By the time we finish drawing out or cleaning out all the infection, the nyama, the dirt inside that place, the hole is now clean. Then we'll now put some medicine in there. We'll ask you to go home. Come back in a week. When you come back, then, you know, we cannot leave the hole empty like that. We have to fill it. It's like a well that is no longer functional. They will now load it with sand. It's something like that. The dentist will now put something to fill up the hole. Why are we doing that? So that bacteria will not have place to breed again. When we now do that, we will now put a filling on top of the tooth. It's like a bricklayer plastering a hole on the wall. Why? So that bacteria and germs will not enter into it again and no longer be paining you. So you will have your tooth in your mouth and it's not paining you. That's a root canal though. So it's not every time that your tooth is paining you that you remove it. See your dentist today.